The need for community support has never been greater, and at Sun Life we recognize that we have an important role to play to ensure that our communities feel supported during this very unique time. We know that those living with diabetes are at increased risk of complications from COVID-19, so our continued work in this space is more important than ever. Our support during this pandemic will allow organizations to continue the great work they are doing to address the needs of the diabetic community, while also addressing important topics around health disparities and food insecurity, which have only been exacerbated by COVID-19. We team up with many organizations in the diabetes space, some prominent, some really grassroots, giving to programs that support diabetes prevention, management, education, and awareness, as well as healthy living and nutrition. We also want to address health disparities and food insecurity among communities of color, those affected by diabetes or those who are at risk for being diagnosed shouldn't have to face this alone, and their access to and quality of care should not be dependent on their income or zip code. That is why we focused our grant program this year on communities that have been significantly impacted by the COVID-19 pandemic and need the greatest support. We've been doing the Team Up Against Diabetes grant program for 5 years now, and we've given over $1 million to local community organizations all over the country. This year, we are so proud to fund over $250,000 in programmatic support to 5 very deserving organizations. Our largest grant this year was awarded to Emory University in Atlanta for a program focused on preventing diabetes among minority men. By leveraging the power of soccer and combining recreational sports activities with nutrition education, they hope to reduce the pre-diabetic status of participants and make a significant impact in a community that is heavily affected by diabetes. Another organization we're supporting is the Physicians Committee for Responsible Medicine and their Native Food for Life program, which focuses on the prevention and reversal of diabetes in the Navajo Nation and the 8 northern pueblos of New Mexico. Native American and indigenous populations face significant challenges when dealing with access and quality of care, and have one of the highest rates of diabetes diagnoses among all minority groups in the United States. Our grant will help support culturally relevant programming to address ongoing health disparities within their community. In Massachusetts, we are supporting Victory programs and their Food Insecurity Reduction and Nutritional Education Initiative, which provides food insecure families in the Boston area with fresh produce and nutrition education through an urban farm. In Seattle, we are also supporting the Hunger Intervention Program. Through their community food and fitness program, they seek to increase health equity through community events that provide culturally relevant nutrition education, cooking classes, and fitness activities. And last but certainly not least, we will be supporting the Supportive Older Women's Network and their Philly Families Eat Smart program in Philadelphia, which focuses on increasing healthy eating and physical activity in grandparent-headed homes. Congratulations to all of this year's Team Up Against Diabetes grant recipients, and thank you for your continued commitment to our communities.